Hi, I'm Paul Taylor. I'm an orthopaedic spine surgeon and director of the fellowship program at NeuroSpine Institute in Perth in Western Australia. We are now an AO Spine accredited fellowship centre in the Asia Pacific. AO Spine is the world's leading academic institution for orthopaedic and neurosurgical spine surgeons. Certification by them for our fellowship program really comes as a recognition of our teaching background and of our academic history. A fellowship with NeuroSpine Institute is open to both orthopaedic spine surgeons and neurosurgical spine surgeons. We have both orthopaedic spine surgeons and neurosurgical spine surgeons in our practice, and you will work with all of them. Our caseload is predominantly degenerative, though we do have some deformity, tumour and some trauma. We do a lot of minimally invasive spine surgery, and we have a lot of decompression technique surgery. We have minimally invasive anterior lumbar fusion exposure, some dynamic surgery exposure with total disc replacements and other lumbar dynamic techniques. All of our patients have their data prospectively recorded. We have a large database now of patients that we can use for both our own purposes and also for academic research. One of the other great advantages of coming to Perth is it's a fantastic city to live in. We're in the centre of a beautiful state in Australia, and there's an awful lot right on our doorsteps, and frankly, who wouldn't want to live in Perth for a few months?
I'm Sonia. I was born and raised in Germany, but moved to Switzerland after studying medicine in Berlin. I started my training as an orthopedic surgeon in 2015, and now I'm almost at the end of my training, which is a good time to do a fellowship for more hands-on experience. I started 9 months ago as a trauma fellow at Fiona Stanley Hospital here in Perth, Western Australia. I already knew early on in my training that I wanted to specialize in spine. As NeuroSpine Institute's first AO Spine Fellow, I have 6 months of full-time spine exposure. I spent most of my time in the operating theatre with one of the 4 surgeons for one-on-one training. My technical skills as well as my clinical decision-making skills have improved tremendously already after only 6 weeks. Aside from expanding my technical skill set, I ultimately want to be able to provide each patient the best possible outcome. When I started working as a young doctor in Berlin, I was assigned to the spine ward. I didn't have much to do with operations yet, but mainly assisted. But I really enjoyed the specialist field. For me, the spine is fascinating because it has so many facets, literally. You treat patients of all ages. Diagnosing symptoms, and especially on the neurological side, can be very interesting. It's a challenging and fascinating area of medicine, and I couldn't imagine doing anything else now. I first heard about the launch of the AO Spine Fellowship program at NeuroSpine Institute last year, when I was still working full-time in the orthopedic department at Fiona Stanley. Originally, I was only going to stay in Australia for 6 months, but I chose to apply for the NeuroSpine Institute Fellowship. What excites me the most about being part of the team at NeuroSpine Institute is that I get to work with 4 independent surgeons from both neurosurgery and spinal orthopedics. All the surgeons were trained in different hospitals, so I am exposed to so many varied techniques and treatment strategies, which is unique. My experience to date working with the entire clinical and administrative team at NeuroSpine Institute has been really positive. It's an absolutely fantastic place to work. Everyone has welcomed me warmly and are willing to assist with answering my many questions. The best thing for me personally is my structured work schedule. I know exactly what surgeries are scheduled and how long my days are. And over the weekend, there is just occasionally some work to do, like urgent surgeries or ward rounds. For me, this is a huge help in balancing work, research, and personal time to explore Perth and all its beautiful surrounds. Also, it's great that I have time to do research. NeuroSpine Institute employs a postdoc and a PhD student, and they are doing intensive research on patient data to improve patient care and treatment strategies. There really isn't anything negative I can tell you at this point. I'm just a little upset that I'm missing some surgeries because of the current limitations due to COVID. I hope the restrictions will ease soon and we can continue to do more complex surgeries. It would be really great if we could organize an official NeuroSpine course here in Perth. This could be partially coordinated by the Spine Fellow and would give them the opportunity to expand their network with the NeuroSpine. My advice for future fellowship applicants: stay for at least 1 year. In terms of surgeries, it's a combined fellowship in the public and private system. In public, you can operate independently. In private, however, all surgeries will be done under supervision. Also, if you are from overseas like me, be aware that it can take several months to apply for accreditation with the medical board and Medicare, etc. I recommend starting with the paperwork early, about 1 or 2 years before you arrive. I am here in Perth completing the fellowship for another 5 more months, which I know will fly by. From here, when I arrive back home in Switzerland, I will work 50% as a junior consultant in the spine team, and I have 50% protected research time. During this time, I will complete a PhD in clinical science at the University of Bern. I miss Perth and the team at NeuroSpine Institute, but we will continue to collaborate in the years to come.